Hi guys, our topic is gangrene and it comes under cell death. So, what is gangrene? Simply, we term gangrene as a necrosis plus putrefaction. So, what is putrefaction? Putrefaction means pus formation, process of pus formation, and necrosis. Necrosis means it is a type of cell death which involves inflammatory reactions also. So, what is most common cause of necrosis? That is seen in gangrene. So, coagulative necrosis is most commonly seen in gangrene. What is cause of coagulative necrosis? That is ischemia. Now, what is cause of gangrene? So, gangrene occurs due to any virulent bacteria. That bacteria will lead to tissue necrosis. Now, one line is given in our textbook Hurst Mohan that gangrene is followed by liquefactive necrosis. However, now why gangrene is followed by liquefactive necrosis? Because here we see the putrefaction, pus formation. So it will leads to the liquefactive necrosis. So pus formation will occur. So not only just dense material, the semi-solid consistency will seen. So we can say it is followed by liquefactive necrosis. Now types of gangrene. Gangrene it is of generally two types, dry gangrene and wet gangrene. And another variant of a wet gangrene is gas gangrene. Now we will see one by one. First of all, there is a dry gangrene. So what is most common cause of dry gangrene? That is ischemia. And where we majorly see the ischemia in the distal parts of our body. That is majorly toes and feet. And why? Due to atherosclerosis in the blood vessels or blood supplying vessels. Here, the cause of ischemia not only atherosclerosis but any thrombus formation also be there. So it's of all about dry gangrene. It will usually occurs in the distal parts of the body. Now we see what are the other causes of the dry gangrene. So there are specially three conditions mentioned here. First of all, there is a thromboangiitis obliterans. It is also known as Burgos disease. So what is in this condition? If we see thrombo means we can tell there is some plug formation or clot is there. So here any blood clot is seen in blood vessels, it will block the blood vessels. So it will lead to ischemia at the end, and at that part dry gangrene will occur. Second condition, Raynaud's disease. So what is in Raynaud's disease? Here it is written over there, episodic spasm of a small blood vessels. હવે episodic spasm થશે તો definitely it will lead to ischemia, and especially this condition is seen in toes and fingers. Third other cause is trauma, and fourth one is agate poisoning. Now what is agate poisoning, guys? You are aware about it or not? I am not knowing, but generally in medical science it is used in migraine medications. And also there is some story like it was found in infected grains, like grains infected of the fungus named Claviceps purpura. Now we will see some characteristics about the dry gangrene, that how dry gangrene is initiated and progressed. So first of all, it is initiated in most distal part. Most distal part of a body we can imagine it is our hands and our toes, especially fingers and toes, that are farthest from our body. And we said already there is ischemia is there, so there is no blood supply. So there is no blood supply, then it is hard, it is not a favorable environment for bacteria to grow over there. But still, at any cause, at any conditions, bacterial growth start appearing over there, and it will spread upwards, means it will spread more proximal to the body center, means to the viable tissue where blood supply is much sufficient. They will grow upward, spread upward, and here they can get their nutritions also. So in short, from the ischemic part they travels up to the viable. So another is line of separation, that is key characteristics of dry gangrene. What is line of separation? It is a clear remarcation between necrosed part and viable part. So you will clearly identify by drawing a line that it is necrosed part or it is viable part. Means it is not infected by gangrene. Now if we see grossly, the dry appearance will be there, shrunken, black, and like a mummified food. And if we see microscopically, then we see necrosis plus inflammatory granular tissue. You have most often heard that gangrene future that you have to amputate that part. It is mostly suggested to, to the patient having gangrene. Either it is dry, wet, or any type of gangrene. So why amputation is needed? If you not done amputation, then the gangrenous part will fall down on its own from the line of separation. So amputation is must in gangrene. Otherwise it will spread upward to proximal to the body, and it will spread infection and lead to septicemia, which is again emergency condition most threatened. So that's all about is of dry gangrene. Now we will move towards wet gangrene. Now here you can clearly identify or clearly say that wet gangrene means something moist tissue will involve, specifically organs. Now there are two examples were written over here, that is diabetic foot and bad sores. So mostly in case of diabetes, wet gangrene will occur because there is abundant sugar in blood, so it will lead fast bacterial growth. And in case of bad sores, you have mostly seen in bed rest patient or paralyzed patients. So affected part is reach of blood supply. Why reach of blood supply? Because there is a venous blockage. So if there is a venous blockage, so blood will be there, sufficient blood will be there. Blood is getting in but is not returning properly. So blood will be there, sufficient blood will be there. So if there is a blood, there is high much of nutrients will be there. So fast bacterial growth will occur, and bacteria will produce toxin, that's obvious, and that toxin by means of absorption will come into circulation and it will lead to septicemia. Septicemia means your infection is spread all over the body. Now, like of dry gangrene, there is no clear demarcation, there is no clear line of demarcation, and sometimes this infection will spread to the peritoneal cavity, which leads to peritonitis, which is basically inflammation of peritoneal cavity. Now if we see grossly, it will be softened, swollen, putrid, because there is a more bacterial growth is there, so it will more smelling like rotten, and it will dark in color. Why dark in color? We have discussed earlier here that bacteria will produce toxins like hydrogen disulfide that will hemolyzed, and from that iron will be released and iron sulfide will form, which is black in color. So there is also in wet gangrene blackish appearance is there, dark. And histologically or microscopically you can see there is a liquefactive necrosis plus blood, because I said there is a blockage, venous blockage, so there is a abundant blood is there, and also there is ulcerated part, there is a mucus slotch over here, and there is also inflammatory exudates. Why inflammatory exudates? We know in case of necrosis there is inflammatory process is also noticed. So in case of producing inflammations, there is inflammatory exudates will be there, and there is a thrombosed vessel. Why thrombosed vessel? Because there is again blockage. The blockage will obvious first by any thrombus. Now there is example that is a strangulated hernia, volvulus, and intussusception. Now what is hernia? You know that is a protrusion out of any softened material through a muscle wall. So it is basically hernia in which there is a blood loss is majorly seen. In volvulus there is, intestine, small intestine, it is of highest length. So in case of volvulus there is an intestinal loop, it twists on its loop. So another loop है duodenum, jejunum, ileum, that all will loop over its own, that will leads to, that is known as volvulus. And if any one segment of that intestine will loop over another segment, then it is known as intussusception. Okay, I think you guys were clear of it. Now there is another part, another variant of wet gangrene, that is gas gangrene. So basically there is no anything else. There is a gas producing bacteria is there which produce gas. So at the gangrenous part you visibly see a bubble, like a gas bubble coming over there. So it's basically due to gram positive bacteria clostridia. They can be contaminated through open wound, any injuries like roadside injuries, or in case of colon operations, infection of clostridia is seen. Now what will occur? Again same necrosis plus edema, inflammatory responses. Also pus will be there, toxin will absorb, same like wet gangrene, and at the final septicemia will occur. Now if we see grossly, then we see swollen edematous appearance with pain, crepitation, and CO2 bubble will be there due to the fermentation of sugar. You know there is a blood supply abundant, and especially in case of diabetes mellitus, you will see there is a high amount of blood sugar. So this bacteria will ferment the sugar and release CO2. And this fermentation is done by toxins produced by this clostridia. Okay, and crepitance means it is a sound જે તમે એક પેપરને ડૂચો વાળશો અને પછી ખોલશો જ્યારે અવાજ આવશે, that typical sound is crepitant. It will be dark in color and foul smelling. Okay, and if we see microscopically, there is coagulative plus liquefactive necrosis, you can say caseous necrosis. Now bacteria will be positive, gram positive bacteria will get our microscope, and there is an infiltration of the lymphocyte at the periphery of the necrosis. Now this is necrosed part, so at the periphery of it you will see leukocytic infiltration. Okay, and obvious thrombus is that which is responsible for venous blockage. So that's all is of gangrene. If you have guys any doubt, please tell me, I'm here to solve it. And if you find here any concept is not correct or any misconception is occurred, then please guys kindly inform me, because I am also a student like you. But whatever I have gone through, I think it will be important to you guys. So I'm making its notes for you guys. Thank you all of you.